Hello and welcome to episode 31 of the Dental Realist podcast. I am Dr. Ryder Waldron and I'm joined as usual by Dr. Troy Stevens and Dr. Marcus D. Neff. Troy, how's it going tonight?
Going really well. Glad to be here.
We're glad to have you. And
Yes.
Marcus, how are you doing tonight?
You know, I'm doing fantastic. I have pressed the record button, and my recording is recording.
Yeah, so if anybody listened to episode 30, you noticed that Marcus wasn't with us for the last, 20 minutes of that show. Marcus, do you want to tell us what happened there?
I don't know what happened. I don't know what I think.
You're not getting paid to think.
That's true. Somehow something got clicked and pushed, and the audio stopped recording. But this promises to be a much better episode because I will be present the whole time, and I know that our listeners definitely want to hear my voice the entire time.
Yeah.
Absolutely.
Yeah. Troy and I can't carry this show all the time.
No. You have too much wisdom to let it
That's
go
right.
wasted, Marcus.
Yeah.
And
Thank
for tonight's topic, we definitely need you, Marcus.
All right.
We do.
I'm here
we
for
definitely
you.
do.
I'm here for you at least for the first 20 minutes.
Yes, well,
Can't guarantee anything after that.
periodically we may check in just to make sure things are still recording.
Yeah.
That's a
Watch
good
the little
idea.
timer on your recorder. Make sure it's still ticking away.
That's true. I am using a tape recorder to record this. So
Cassette.
I usually get the cassette in the mail the next day. and
Yeah.
Ryder gets it and somehow converts it to digital.
I'm like a mix master. I used to DJ back in the 80s, so I know how to whip all this stuff together.
That's
Yeah.
right.
So we're going to talk about another listener's email tonight. You guys ready? You want me to read this?
Yeah,
in?
let's do it. Let's
Read it and we
Okay.
can talk about it.
So this is from a dental student. The email says, I've listened to all of your podcasts and really appreciate y'all's honest and open opinions on the current state of dentistry. I had an additional question to what an additional question to add on to what y'all talked about in your podcast on questions from a dental student. My question is it worth it to go to residency programs anymore? It seems that as a GP dentist, you can do these one-year residencies, GPR or an AEGD, and learn a lot of the procedures offered by specialists with an adequate amount of training to be at or near their level. Would it be better for a graduating dental student to do one of these programs tailored to what they want to do, molar endo and implants, instead of doing a 3-year residency program and lose out on a couple years of income? I know GPR and AEGD graduates placing 60 to 80 implants and doing over 100 molar endo cases in a year and feeling very comfortable to start doing that in their practice the next year. What are your thoughts? So guys, initially, what are your thoughts? Troy, let's start with you.
Well, I think we're going to be able to talk a lot about, pros and cons and things like that tonight. Maybe what I can tell you before we get into that is just kind of my experience. I was 32 when I graduated from dental school, so I was a little bit older than most people are. And I personally did not want to put another year out to do anything. I wanted to get out and start doing stuff. So some of it, I think, will play into, your age, your marital status, things like this. If you wanted, if you want to live in another area, move again. Some of these AEGDs would require you to move to another location that you're not even in dental school, and things like that. So there's a few of those things that I looked into. I had no desire to do it. Looking back, do I wish I would have done one? No, I don't. I feel like, I just like any dental student, I guess, feels when you get out of dental school, you feel like a safe beginner. Like Gordon Christensen says, for the first 5 years, you're a safe beginner.
Yeah.
You're not really proficient. You learn a lot during those first 5 years. But I'm guaranteed there are advantages to it as well, and that's what we'll discuss tonight. But my own personal thing was, I'm not disappointed that I didn't do one. No.
Yeah. So, Marcus, you have a pretty unique perspective on this because you actually work at one of the residencies. So why don't you give us a little insight into like what a normal day or week is like at the residency and what you see with these students that you work with?
Yeah. So first let me say, I wasn't nearly as old as Troy when I graduated. I was 30.
Oh, yeah.
Yes.
Seriously, who was?
Yes, I know.
So,
I was 22 when I got out of dental school. Troy was like 50.
that's true. You were on that accelerated path.
That's right.
A lot of your prereqs
Well, that's because
done
you're
in high
Marcus's
school.
son. You have to be younger. You're Marcus's son.
They gave us a father-son discount.
That's right.
Have we told our viewers that story?
I think we have, but we might need to revisit that later on. That's a good story that can't be told enough.
Yes, that is a good story.
Come on now. Well, I do work at a residency, the Idaho State University Dental Residency. It's a 1-year program. I started working there about, I guess it's been 3 years, maybe almost 3 years ago. I help with CAD/CAM stuff, so CEREC. They have CEREC there at the residency, and I wouldn't say I'm like some guru, but I've done a lot of it. I've attended a lot of training, and so I feel pretty comfortable with it. So they heard about me through somebody else who worked at the residency, and so I go one Friday a month. I'm not there super often, but that's primarily what I focus on. But the residency itself, at least at Idaho State, covers a pretty wide variety of stuff. I mean, they're learning sedation, IV sedation. So by the time they finish the course, they're IV sedation certified. So wherever they go, they can apply for that state's IV sedation permit and jump right in and be doing IV sedation. They place a whole lot of implants. So they do oral surgery, a lot of advanced oral surgery. They have an oral surgeon, a couple of oral surgeons that come in and they learn advanced oral surgery. They get pretty comfortable taking out wisdom teeth. Like I said, placing implants. They have an endodontist that comes in a couple of times a month, and so they get pretty comfortable in molar endo. So these guys are coming out of that residency after a year with a lot of pretty real world type experience, and I think they're pretty good at general dentistry, of course, but even some of these specialty procedures. And so, I mean, it's kind of a cool thing if you determine a residency is right for you. Find a residency similar to that, in my opinion.
Yeah, that's a lot of good stuff. I was like Troy, and I wanted to get to work ASAP, so I didn't really consider it, but we had some people in our class that did them, and I don't know if they would say that they would do it over. I know I've talked to one, and he said he probably wouldn't do it again because he felt like it was just another year of dental school. But man, if you're learning how to place implants and molar endo and stuff like that, I mean, that'd be great because that's stuff we don't get a lot of in dental school.
Yeah, I was like you guys. I'd been in school and I was ready to get out of school. I was ready to just get out there and do things. And I'm one who probably, after working in this residency, I look at it and I think, man, that probably would have been a good thing for me. I started off just doing a practice from scratch, and I was maybe a safe beginner, as Troy talked about, but as far as really being confident in my skills, I don't know that I was there, and definitely not in some of that advanced stuff, some oral surgery and endo. I don't think I had felt comfortable, and still to this day, it's probably not one. Those are two things that I probably don't feel as confident in and do as much of.
Yeah, that's probably me too. I see a molar endo, and I'll do some real simple ones, but man, it's such a nice feeling to send that baby off to the endodontist. But it'd be nice to be able to have a little bit of that experience. So, Troy, what would you see as some of the benefits specifically of doing one of these year-long residencies versus doing like a 3-year endo residency or oral surgeon residency, something like that?
I think it would put you past maybe a little bit more into the comfort zone of treating people. We told at one time a story, and I'm kind of using Marcus as an example here, but when he got out of school, one of the first things that happened when he was filling in with a guy, someone threw in, says, "Hey, you're doing a molar endo on number 2." And remember that, Marcus? I think we told our viewers that. So yeah, I think that I think that they'll be a little bit past the safe beginner stage, maybe a little bit more comfortable with some of the procedures, like Marcus said, maybe molar endo, oral surgery, some of those things. The concern that I have is if you go to risk management seminars and stuff like that, when people get sued for molar endo, for oral surgery, which are some of the two highest litigated things that general dentists do, they will still be held to a standard of a specialist. So, you got to kind of keep that in mind. Even though you may have a lot of experience, you still want to pick and choose your cases. Make sure you don't do anything that's something you don't feel comfortable with. Like Marcus, when you came right out of school, Marcus, you remember that when that guy scheduled you for that number 2 molar endo, you were just brand new out of school, weren't really overly confident in it.
Yeah,
And that would probably be, you probably would have been a little more confident had you done an AEGD or something like along those lines.
Yeah, I agree with that. I think there's just a certain level of ability and skill you get, because you're still, I mean, it's different than dental school, the way these residents are treated at the residency where I work. We often remind them that when they start asking us early on, can you come check this? Can you look at this? What would you do? We usually remind them, hey, I'm happy to give you my opinion, but you have the same degree after your name that I do. So, and they're licensed. I mean, they're fully licensed. So we try to push them to be a little more independent, and it doesn't take too long that they get a little more confident, but they feel safe because they know there are faculty there that are ready to back them up or give them a little bit of help if they run into something.
Yeah, absolutely.
Yeah, definitely. That's totally true. What do you see as like some of the drawbacks, Marcus? Are there any to doing a residency like this?
Well, I think you have to be really careful about where you go. I've talked to some of these residents at ISU, and most of them will interview at different residencies, and they look into different residencies. And from what I understand, ISU is a pretty good one. I'm sure there's other good ones out there, but there are some that they've said, I had a friend that went to this such and such residency, and pretty much all they did was just a bunch of fillings all day. And they don't really get a lot of exposure to a variety of things. So definitely, I would say all residencies and all residency programs aren't made equal. I mean, you've really got to decide, is this one that I'm going to be able to do the kinds of things that I want to do, or get pushed to do things a little out of my comfort zone, or do I just, would I be better off to just go out there and start making money? Because if you're just going to go to a residency program and just do fillings, well, you might as well just go out into practice and just do fillings, because you'll start doing plenty of those if you go out into the private practice world.
Yeah, that's the bread and butter. And I could see with insurance payments and reimbursements being what they are nowadays and going down, it's tough to refer out stuff. I know a lot of dentists like to keep stuff in-house and do as much as possible. So delaying work another year, it may pay off in the end. You may be able to do more treatments and stuff like that over time. So maybe it would pay off even delaying a year. But Troy, do you see any drawbacks to doing one of these?
Well, I think that some of them we've touched on a little bit is just it does put you 1 year of income out there. You can still do molar endo, you can still do extraction, you can still do those things if you feel comfortable out of dental school. Marcus kind of touched on one thing too, just real briefly, is these residency programs aren't all equal, and depending on what residency program you get and do, that may train you to do the things you want. But also, I think dental schools are that way. I think that there's some people that come out of dental school that don't feel comfortable doing simple things, where I came out feeling okay with stuff. I didn't feel like I was overly confident, like over the top, but I felt like I could do it. And so, I think that also has to play into effect. If you feel like you're kind of maybe lacking in confidence, perhaps, considering one of those. But another drawback may be just the fact that, you're, are you really going to practice those things when you get out in the real world? Marcus mentioned the IV sedation. All of us have been certified in conscious sedation, not IV sedation. And I am really happy I'm not doing that anymore in my practice. You know what I'm saying?
Yeah, me too. That's been my experience.
I spent so much money to train myself, my staff, to certify, my office, all this stuff to do it. And it did nothing but increase. And this is just me personally. This isn't for everybody. A lot of people say the opposite. But I felt way more stress doing a sedated patient in my office than I do just a regular patient that may be slightly nervous. The reason I say that is because now that I have opened myself up to liability for a person who is now on drugs that are sedatives, and now I have to manage a medical emergency. I need to manage, oxygen, airway, and these things, and I have to do perfect dentistry. So to me personally, I don't think that that's a positive thing, unless you plan on specifically doing, say, IV sedation with implants or IV sedation with third molar extractions, or some of those things. In my personal practice, I really am not one of those persons that likes to do that. I've got enough stress just trying to make sure that I'm doing stuff the way I'm doing it now. So,
yeah, I had to sedate a patient one time, and it was not conscious sedation, with IV sedation. I had a nurse anesthetist come do it, and it was amazing. He monitored everything. He did everything. Woke her up afterwards, and it was great. And I could just lay there and do dentistry. But when I would do the conscious sedation,
you were laying down.
Oh my gosh, I was so relaxed. I laid right by the patient. I did some dentistry.
Oh, darn.
The patient laid there. I stood there.
Okay.
Close call there. I just did the dentistry, and he managed everything. It was awesome. But I was like you, Troy. When I would do conscious sedation, I was nervous, probably more nervous than the patient was. It just didn't. I don't know. I didn't love doing it, and I think Marcus felt the same way. But
yeah, it was the same for me.
Yeah. So, yeah, I
something that I was going to bring up. Another type of residency. So a lot of our listeners may know that I'm in the Army Reserve, so I go for 2 weeks a year and go to these different military bases and do dentistry for a couple of weeks. At most of these military bases, they have guys that have just finished and girls that have just finished dental school, and they owe some time to the Army. They'll come out and they'll do a residency in the Army. So if that's something that you're considering, joining the military for student loan repayment, along with that, you can do a residency program through the military that does a lot of these things that I've talked about, like at Idaho State. You'll do sedation, you'll get more advanced training in endo and oral surgery and all those kind of things. So, I mean, that's a type of residency to consider if you also want to try to get student loan repayment. Mm-hmm. And they also offer specialty programs through the military too. So, again, if you're looking that direction towards student loan repayment, and wanting to specialize or do a residency, that's a potentially a good way to do it and come out debt free and get the training and when you're all done, be able to just hit the road running debt free.
Yeah, that's amazing, because we talk about debt a lot.
Free sounds pretty good.
Yeah, we talk about debt a lot, and debt, man, it's a killer. So if you could do that, and you might delay getting into practice, but man, you'd be ahead of the game, I think, and you'd have a lot more skill.
You do get paid when you're working in the military. I mean, you're going to get paid. It's not the same pay as private practice, but anyway, I just think, especially in today's world where the cost of dental education has gotten so high, it's at least worth considering, more so than maybe we would have, or I even did back when we were in dental school.
Yeah, I can't think of. I mean, I can't remember how many molar endos I did in dental school, if any, and oral surgery. Taking out wisdom teeth, we'd do a few, but we didn't do a ton of that stuff. So, and it's something I still don't feel that comfortable doing. I don't do any third molars. Like I said, I do an occasional molar endo, but not that often. But we got a lot of crown and bridge and denture training at our dental school, and I feel comfortable doing all of that stuff now, and that's probably more enjoyable than any of that other stuff. So,
and you haven't been sued yet?
Not yet. Please don't say that, because now you may have jinxed me.
No, I just kind of going back to that thing. I went to a risk management seminar last month, and it's just that's one of those things. You got to be very cautious in what you're doing, and molar endo. And surgical extractions and things like that, those are the things you're going to get nailed on if you start biting off too much.
Absolutely,
you can really get yourself in a world of hurt as a general dentist.
Yeah, and I mean, taking out wisdom teeth, it's, as far as profit goes, it's really not that profitable, is it? I mean, I always hear the oral surgeons, they'll have those suckers out in 20 minutes, and extractions just aren't a real profitable treatment to provide. So, if you're going to refer something out, it would definitely be that. Implants.
I think it depends on how fast you are. If you can pluck them out in 25 minutes, charge $2,000, I guess that's pretty good.
Yeah.
Yeah.
I couldn't.
But I can't do it. So
yeah.
I would mess around for 4 hours.
Yeah. Yeah. And that's always an awesome feeling when you break a tooth off and then have to end up referring it to the oral surgeon anyway. That's a good feeling all around.
Right.
Cool.
Okay. You know that no, go ahead, Ryder.
No, I was just going to ask another question, but go ahead. You go ahead first.
All right, I will.
Yes, please.
because I didn't get to talk as long in our last podcast.
We're just happy you're still here. You are recording, right?
Yes, I'm looking at it right now,
Okay.
and the timer's still going. The button is still clicked.
Okay.
I'm still here.
Dodged. Okay, go ahead. Let's hear what you have to say.
No, I was going to say, our listener who emailed us, they asked, is it worth doing a residency program to become an endodontist or an oral surgeon? Or would it be better to just go do a residency? And I think you could really, if you really figure out that you love oral surgery or endo, and you really want to, do it the best way possible and have the best career out of it, I would say go do a residency, or not direct. Go do the specialty training. Sorry,
Yeah,
I got that backwards. But if it's something you're pretty interested in and you want to do it better than the typical person, and you want to make sure it's a part of your practice, I think a residency program would be the way to go. Why, if you're thinking you're going to do other dentistry anyway, why limit yourself to just oral surgery or just endo and spend all those years and additional debt?
Yeah, I agree, and I think the three of us, we had planned on going into general practice anyway because we didn't want to be stuck doing the same thing over and over every day. Doing molar endos all the time, the real tough molars, or taking out teeth or whatever. But then you get stuck doing the same thing over and over every day. It's cavities and crown and bridge and stuff like that. So it's kind of the same deal, I guess. But
yeah, once you've been doing it for long enough, you're going to be doing the same things over and over.
Yeah.
Even if it's fillings, crowns, bridges, implants, whatever it is, you're still going to feel like you're doing the same thing over and over and over.
Yeah.
Endo, however, I can imagine that is really repetitious.
Oh yeah,
that could be if you're an endodontist, and maybe an endodontist can chime in on an email, if they ever get really, my gosh, can I do something different? Because my endodontist that I send to, they don't do fillings, they don't do anything. They just endo, send it back with cavitators in it, and I actually do the final restoration.
Yeah. Well, looking back, guys, I guess knowing what you know now and looking back to when we graduated, what kind of residency would you look for? What kind of training in a residency would you look for? Because a lot of our listeners are dental students and future dentists, and they want to know, what they should look for now. They need our wisdom is what they need. So, Troy, what would you look for? What do you wish that you had learned back then that you still don't know now?
Boy, that's a really tough question, because I've noticed that as I've been practicing longer and longer, I like and dislike certain things more and more. For example, when I was in dental school doing my oral surgery rotations, I absolutely loved it. I loved taking out third molars. I loved all that stuff. And now I absolutely loathe it. So I, like you, Ryder, I refer every third molar. I do not enjoy that at all. Perhaps if I did IV sedation, would I like it more? Maybe. But then again, like I say, then you're adding in the stress of managing a medical situation and a dental situation at the same time. If you could get in and like Marcus mentioned, and he does, they have a nurse anesthetist come in or whatever, that might be the way to go. But I think the thing I think is challenging, and part of the reason we've started this podcast is that I think it's almost nearly impossible when you graduate from dental school to know what you're going to like in 5, 10, 15 years. You may really enjoy endo now, but doing it day in and day out for 5 to 10 years, are you still going to enjoy it? Are you going to be able to do it for the 30 years that you need to work? Or, oral surgery or crown and bridge, dentures, implants, whatever it may be. So that's a really tricky question. Personally, when I look back on it, like I said in the beginning, I don't think that I think I made the right choice. I don't think that I would have personally done a GPR, and at this point, I wouldn't have gone back, in time and done one at that point anyway. I feel like my practice has kind of morphed into what I would want it to be anyway.
Marcus, what about you?
Yeah, I think I probably should have done a residency, to be honest. I just feel like doing a startup practice, I would have been better off to have felt more confident about my skills and speed and all those kind of things, and maybe had a little more, definitely more confidence in doing some treatments like endo and oral surgery. Because in a startup practice, I didn't have the luxury of solo startup practice. I didn't have the luxury of somebody else to kind of turn to. I really needed to be producing right out of the gate in a startup situation. It was imperative that I really get after it and produce a lot, given that I had a new building, new equipment, all those costs. And so if I was going to go back and do it the same way again and do a startup practice, I think a residency like the one where I work, something like that, would have really benefited me so that I was better able to just come out and produce and do a lot more dentistry.
That's a good point. Can I just say one other thing real quick?
Yeah.
I came out into a totally different environment than Marcus did. I came out and I was working with two other doctors that had been practicing for, the one doctor for 40 years and the other one for, 15 years. So I had those folks in the office for me should I need them. So kind of, based that what I had said earlier on that premise, like Marcus said, he had a whole different environment with a startup. I came out, the practice was going, I had patience, I didn't have to worry about some of the things that Marcus did.
That's a good point, yeah.
Yeah, that's something I hadn't thought of. I guess knowing what kind of practice situation you want to go into would be, really important. If you're going to look to buy a practice from another dentist and be there all by yourself as a new dentist out of school, yeah, going to a residency, that would probably help a ton. But then if you're going to be going and doing an associateship or joining a practice like Troy did, then maybe you don't need that. Maybe you can get some more on-the-job training from the guys. But yeah, I had never thought about that. I'm learning something from this podcast tonight myself, because I hadn't really thought of that. I guess I'd probably try to figure out what my goals were as far as jobs.
This is why we have Marcus on, because he strikes all of the knowledge.
I did record that, by the way, so we can actually put that out.
Yeah,
that will be there.
I wonder what I would have learned if Marcus had been able to record his audio from last week. What?
There was so many wonderful things I said. Yeah. I mean, it's just amazing.
It was.
I feel like everybody missed out on what Marcus had to. You probably could have saved everybody's careers, Marcus, but whatever.
I know. Sorry to that person whose career went down the drain, because I wasn't there for you.
Yeah, well, whatever.
He's making up for it tonight.
Yeah. Well, guys,
words of wisdom.
Yeah. Any other words of wisdom you wanna add? We can. Tell another story about how Marcus has been mistaken for my dad.
Yeah.
Anything like that.
That was a fantastic story.
I think we've told that on one of our previous podcasts. So
yeah, I'm pretty sure we did.
But yeah, Marcus has been mistaken for my father a couple of times.
Yeah, I don't know why. I really don't know why.
You really don't look that old, but maybe I don't. Maybe I look that young. Who knows? But. Well, Marcus, do you want to tell everybody where they can find us and get our books and like us and love us?
Yes. Yeah, we are. We do have a couple of books. So You Want to Be a Dentist is our first book. It's available in print and digital. You can find it pretty much anywhere you look. Amazon, the iBook store. We've also got our second book, So Now You're a Dentist. That one is available in digital format. Another great read. You can email us at dentalrealist@gmail.com. We're also on Twitter @dentalrealist. We look forward to hearing from our listeners, just like the one we talked about in our podcast this evening. So please email us, send us your questions, anything you'd like us to talk about.
And I just had a thought. What we need is an audiobook of Marcus reading our books to the readers or to our listeners.
Oh, wow, yeah.
As long as we can keep the record button going, that would work well.
Yes, that's a good... Somebody else will do that, and I'll just talk.
Yes, yeah. We need a producer. We're going to hire a producer to help Marcus record. Yeah, and we do need to thank our listeners, because we've had our best month of downloads this month, and it's been awesome. So we appreciate everybody everybody listening and making this as much fun as it can be, because we have a lot of fun doing this. So, Troy, do you have anything?
Keep sending the emails, because that definitely helps us to
Yeah.
see what you guys want to hear, and maybe we can give you some insight and hopefully help you out.
Yeah, if one person has the question, it's likely that other people have the same question. So, yeah, we're here.
Exactly.
We're just here to help. Yeah. So
That's why we're here.
That's why we're here. So, yeah, we appreciate you joining us tonight. This has been episode 31 of the Dental Realist Podcast, and we'll see you on episode 32. Thanks.